Welcome everyone to our action plan meeting at General Hospital.
There are many familiar faces here, but let's go ahead and introduce ourselves. I'm Shannon, Vice President of the hospital.
I'm Liz, the hospital administrator.
Hello everyone, I'm Anita, the nurse manager of the medical floor.
And I'm Claudette, I'm the nurse manager for ICU.
So we called this meeting today to discuss our issue of poor retention of graduate nurses. The hospital is losing thousands of dollars annually because of our poor turnover rate.
Well, we need to fix this problem now. I continue to spend all the money from my budget and I spend the time and resources from my nurses.
Mm-hmm.
Well, I'm having the same issue as well. Sometimes when I feel like I'm fully staffed, some of my new graduates hand in their resignation, and I'm short-staffed again.
Well, what do we think the issue is?
Well, I met with Human Resources, the representative DeNalva, and it stated repeatedly, apparently, in the exit interviews that new grads feel ill-equipped and overwhelmed by the technology and information, and they feel unable to perform their work without confidence. They perform poorly because of the high stress, and they feel unsupported by their team members and very isolated. I've heard positive things about a nurse residency program. I wonder if that would be a good fit for our hospital.
Absolutely not. It's way too costly. We're already losing money as it is. I believe, for example, I did read something on a Methodist hospital in Texas. They started a nurse residency program in July of 2004. And it cost them over $93,000 to support 48 nurses through the program. And there's no way this hospital can support that.
But Liz, I feel that the new grads need that. They're eager to learn, but they're overwhelmed. Working holidays, long days, working weekends, they need that. They need the assistance.
I know the same thing as well, especially with night nurses. They have trouble with life organization as it is, and it's hard to assist them during orientation. Also, the night shift is the most undesirable shift. And then this may be the cause of the shortages.
I do recall seeing the information that you're referring to in regards to the Methodist Hospital Nurse Residency Program. As you mentioned, it's costly. However, after further evaluation of the program, the return on investment seemed to make the program well worth it.
There's just no way we could spend over $90,000 on a program we're not sure is even going to work.
Just hear me out. If you look further at their information, their turnover rate improved significantly.
How significant? $90,000 is a lot.
Yeah, I could hire 2 more nurses with that money.
Their turnover rate went from 50% to 13% in 1 year. That's impressive.
That's a lot. Tell us more.
Yeah, tell us more.
Well, look, in addition to spending over $90,000, where are we going to get the people to train these new grads? It sounds like a positive outcome, but we just don't have the right resources right now to tie up our staff.
I realize it's costly up front and there will be a struggle. It's a bit of a risk.
Well, we definitely need to do something about it. We're in a really bad situation here.
Especially at night. I think that patient safety is threatened at night.
Well, since we're talking about patient safety, I guess I'll have to hear you out.
Well, let me just go over some of this information that I pulled up on the cost of the program at Methodist Hospital. I calculated out their initial turnover rate of 50%, incurring a replacement cost of $1.3 million. The following year, the replacement cost at 13% turnover was reduced to a mere $274,000. That's a savings of over $1 million. And we recall the cost of the program was about $93K.
Wow, maybe we really should look into this. We could really use help with retention.
Not only that, the resident can help my new grads develop effective decision-making skills and provide the skilled nursing leadership they're looking for.
Well, have you all heard of the Patricia Benner and her theories of New Vista Expert? It would be a great addition to this new project we're thinking.
I haven't heard of her.
Well, she developed a theoretical framework. The developmental model stages the skills from acquisition, from beginner to expert.
That sounds like a wonderful idea. It will assist the new graduate nurse to transition from new ones to better nurses.
It also provides support for these grads that are essential to retention and also to job satisfaction.
And of course, patient safety.
Yes, patient safety is part of this core curriculum. Also, we have theoretical thinking, communication, professional development, research-based practice, and leadership. All these are very essential for the first year of new grads. And having these skills will cause them to be more confident and more competent.
That's incredible. How do you think we could bring something like this program to our hospital?
Well, as an academic medical center, we need to partner with a school of nursing. We already have a good relationship with a few colleges, so that's definitely helpful. successful.
We can also incorporate the DIFAS skills acquisition, which Finner used. It follows the 4 concept areas of leadership, patient outcomes, professional role development, and critical thinking.
I think that's a good idea. We can collaborate with those the School of Nursing and discuss those details. I still think it will be beneficial for us to pursue the resident.
I do too. Another added point, when I was speaking to Human Resources, Donalva mentioned, according to the National League for Nursing study, 25% of graduate nurses in the 6 to 8 months following graduation had already worked for more than 2 institutions.
That's significant.
Well, tell me more about patient safety with this program.
Well, the nurse resident programs spread greater confidence, competency, and mastery of their job, which in turn improve clinical skills, which is clearly patient safety.
Yeah, it makes sense. If someone is more confident in their skills, obviously patient outcome would be better.
During the nurse residency program, concepts such as evidence-based research and expanding critical thinking skills gives the new grad skills that will make them safer practitioners once they're on their own.
So it sounds like a nurse residency program could do the following for our hospital. Increase patient safety, increase skills and capabilities of our new grads, which leads to higher retention of our new nurses.
Well, I have something else to add. Having a captive audience of new grads in one place will allow us to encourage them to embrace their career.
Also, it will lead to autonomy and empowerment for these new grads.
And when the new grads are supported, they're going to be more successful.
Leading us back to a culture of safety, which is what our goal is, along with retention.
You know, I think we might have $90,000 to start this program after all. Since we've reviewed the positives and the return on our investment, I feel we should take that next step.
This really seems to be the way of the future. We need to stay current.
Let's bring this to fruition. I want the detailed outline of this program on my desk in a month, and let's get going on this.
Good meeting, everyone.
Well, I feel this is going to help the moral retention and the safety of our new units.
I'm excited to start this project.
Great.
Okay.
Thank you, everyone.
Thank you.
Thank you.